Hi, this is Joe Courtney. Again, thank you for joining our website to listen to some of the questions that we've received from Eastern Connecticut over the last few days or so as this healthcare debate now moves towards possible final action in the House of Representatives. Susan from Waterford wrote to our office and said, "It doesn't seem far-fetched that this option, this public option, will drive private insurers out of business, and then our government will be in control of healthcare." Thank you, Susan, for asking that question. It's one that came up frequently again during the town hall meetings during the August break. And what I would say is that if you look at the timeline and the implementation of this bill, it is true that starting in 2013, a national purchasing exchange will be online and will allow small businesses initially to enter the exchange and choose from a menu of insurance companies for coverage for their employees or individuals who, again, qualify for participation in the exchange. Private companies will be part of that menu, and a public option will also be offered to individuals under the House bill as it's presently drafted. The Congressional Budget Office has estimated that by 2019, about 6 million Americans will probably choose a public option. Obviously, we live in a country with over 300 million people. Roughly about 160 million people get their health insurance through their employers. So that obviously, just doing the math, shows that there will be the vast majority of Americans will continue to get their insurance through private carriers. The Hartford Courant last August analyzed the legislation, which again is pretty much the same as it was before the House today. The headline said it all when they said that insurers poised to gain under healthcare reform. The fact of the matter is what we are doing is creating a large number of new customers for private health insurance companies, customers who will be eligible for tax credits and premium subsidies to allow them to pay for insurance that presently today they can't afford. So in fact, I believe the private insurance market will be thriving and bigger than it is today. And as I said, the Hartford Courant and other independent analysts looking at this proposal, particularly through the lens of a state like Connecticut, where we have tens of thousands of people who work in the insurance industry, have concluded that, in fact, we will have a very strong, viable insurance industry with enactment of this legislation. Letter from Scott in Chester. "Great job on healthcare reforms so far. Please keep pushing the public option, as I do not have healthcare anymore since September 1st, 2009, after being laid off in February 2009. National health care and its reform is vital to a long-term stable economy." Well, thank you, Scott, and good luck in your efforts to secure new employment. There are millions of Americans who find themselves in Scott's position because of the fact that we have a system, a health care system, that for working-age Americans ties benefits to your employment. And if there is a downturn in the economy, which clearly has occurred since the fall of 2008, millions of Americans have now confronted the reality of losing benefits and having to pretty much fend for themselves in a very expensive and very, at times, unfair marketplace for individuals trying to secure new insurance. Folks like Scott that have contacted our office, a woman from Norwich, Connecticut, whose husband lost his health benefits because of a layoff, now can't get insurance because his wife is a 63-year-old woman with a heart condition. She had a heart attack at age 54. Under the pre-existing condition rules that exist in the present insurance marketplace, individuals like her and Scott trying to buy insurance are subject to barriers that the healthcare reform bill will break down and eliminate once and for all. And that really is one of the driving forces why I think we need to fix this healthcare program, healthcare system that we have in our country, because if you get sick, if you lose your job, or if you have a pre-existing condition, we have rules that are, at the end of the day, going to deny people, in many instances, the care that they need, and in many instances have paid over years thousands of dollars for. Question 7 from Chip in Jewett City. "The tort system in this country is rapidly driving up the cost of the system. Doctors are forced to practice defensive medicine in this country because of the tort system. We desperately need tort reform." Again, Chip asks a question which came up again frequently during the town hall meetings. visits that I had with healthcare providers at places like Lawrence Memorial Hospital asked about this measure. The revisions in the bill that we're going to be debating over the next few days, in fact, includes new sections, sections 2531, which will give states an incentive through its state malpractice court systems to use early intervention settlement processes to also provide alternatives to malpractice litigation, again, as a way of trying to reform the system and lower costs and the practice of defensive medicine, which Chip described. In addition to that, there was a very interesting new feature of this bill, which is going to repeal the McCarran-Ferguson law, which goes back to the 1950s, that sets up really an antitrust exemption for insurance companies who operate medical malpractice insurance. It will allow for more cross-state sale of malpractice insurance, which should provide more competition and help drive down the costs of medical malpractice. Karl from Brooklyn says, I'm worried a new government plan is the first step towards a Canadian-style system where people face long waits for medical services and less choice of doctors. I am concerned about rising healthcare costs and agree we need healthcare reform. However, I want to keep my current employer covered, so I ask that you please vote no to proposals to create a new government plan. Well, again, what I would say, Karl, is that if you are employed by a company, particularly a larger company, you will continue to operate and your company will continue to operate outside of any government-run system, whether it's a purchasing exchange or whether it's a public option. The fact of the matter is the Congressional Budget Office has looked at this health care reform bill and determined that by 2019, 10 years from now, if a public option is included in a purchasing exchange menu of choices, which the bill proposes to create, only 6 million Americans will be covered by a government-run public option. For the vast majority of Americans who are working-age population, they will continue to receive their benefits through private carriers and through their workplace. Medicare will remain unchanged. Government programs like TRICARE and Veterans Health Services will remain unchanged. And as I said, it'll be only a tiny sliver of Americans who, under the system that's being proposed for a national purchasing exchange with a public option, would in fact be in a position to use it and will elect to use it. Again, I want to thank folks for contacting our office with good questions about the health care bill, which we're considering. Again, we would encourage you to contact our website, email our office, call our office, and we will continue this discussion during an historic time in our country's social history.